Hi, I'm Tom Evans. I'm with the Iowa Healthcare Collaborative, and today Bill Applegate with the Iowa Chronic Care Consortium is with me to discuss population health. I think everyone knows that we're in a period of healthcare reform, and I like to joke that guess who needs to do the reforming? Healthcare. We need to figure out how we do what we do differently. I think everyone knows that our reimbursement system is going to be changing from a volume-based model to a value-based model. But what does that mean? How do we reconfigure the way we deliver care? I think it's important for us to recognize that the volume-based system, which rewards unit-based care delivery, office visits if you will, is going to transition to this more population-based reimbursement model. And as that happens, it's going to change the whole business model with which we deliver care. I think it's important for us to remember, I think the way I summarize it is we're going to move from just fixing broken people to also having to keep people from getting broken. And again, that's going to require us to think about how we deliver care differently within the office. Health coaching can help us achieve these population-based aims, and that's one of the reasons I'm happy to be here with Bill today. I want to talk a little bit about how does this really look in the office. We talked about patient and family engagement, person and family engagement. What does that mean? We have to engage our patients as activated partners. It isn't just about communication. It's about engaging them with adult learning techniques, understanding what motivates our patients, and helping them actually engage as activated partners. Health coaching is a technique that we can use within the office to really help us achieve these population-based aims. I want to take a minute to just kind of think about more of a deep dive on patient-family engagement and some of these other components. Person and family engagement, the whole concept of engaging our patients as activated partners is something that we don't do well. Frankly, we tell people what to do. They come in with a problem and we fix it for them. For us to be able to help them keep from getting broken, we have to engage them in new and different ways. First of all, we need to speak the same language. This is not simply about health literacy, though health literacy is a component. We need to have meaningful conversations and have the patients really understand what we're saying. The second piece that's really important is helping the patient become motivated. If they're going to be an activated partner with us in their care, they need to understand what's going on and they need to own the problem. They need to feel that it's their concern to keep their blood sugar low or to manage their diet or their weight. A health coach is someone who has a special relationship within the office that can help us actually execute those strategies. So patient and family, person and family engagement is just critical with regard to having a health coach. Another real benefit is the operational changes that happen within the office. Care becomes a team sport. It's no longer everybody just the team sport is getting somebody into the room, but now we have people operating at the top of their degrees and actually working to bring what they bring to the whole process of patient care. It frees the physician up. That's probably one of the biggest benefits, is to have this enhanced and enabled team providing education and engagement with the patients, frees the physician up so they're available to actually focus on some of the sickest patients. You know, this all sounds great, but a lot of people go, yeah, but I can't afford to do this. Where am I going to get somebody? And I think the other thing about health coaching is this is actually, there are opportunities to take advantages of new codes. This is a cost-effective strategy. CMS has several new codes now with regard to care management and behavioral health and actually the annual physical exam. So there is a strategy that can pay for this and you'll get enhanced care. I think it's important for us to just realize that health coaching is a technique that can help us really enhance our ability in the office to do population-based care. And that's why I'm so happy to be here with Bill Applegate and the Iowa Chronic Care Consortium and what they do with regard to health coaching.
Tom, it's really kind of a joy to be here with you and listen to some of these wonderful ideas. And in a minute, I'll tell you why I think they're so wonderful. But I think that Compass PTN has done a great job in really supporting practices in their development around population health and also around practice transformation. And the kinds of things that you spoke to in the last few minutes really are precisely the kinds of things that we want to support and develop a capacity in organizations, well, to make the dream come true. So I think a lot of us are aware of the challenges of moving from where we've been to where we want to go. And one of the things that's real interesting to me is that you're a healthcare professional. I was trained as a healthcare professional, and I think most healthcare professionals are taught to do, teach, and tell. Okay, we're experts. Coaches are not experts. They're partners, particularly with patients, to help them find their best interests and their best motivation. In fact, the clinical health coach training is trying to transition people from do, teach, tell to ask, listen, and inspire. How do you inspire people to do that? And you talk so adroitly about building relationships. Building relationship really depends on listening. And so listening skills are a powerful component of how we evoke from people what's important in their life. So one of the ways that we describe this a lot is this. So a health coach that's capable and effective will help a patient find their star in the world and then hitch their health behavior wagon to it. And that's probably a simple way to kind of describe it. But our clinical health coach training does a couple other things, and that is that we really focus on the kinds of people that population health wants to focus on. That is, we focus on those people at risk. Not everybody in a practice gets coached. It's really those people that are most at risk, a lot of people with chronic conditions. And we do two things in our training to get ready for that. And you kind of touched on them already, but one of them is we really focus skill development on transforming the conversation. Okay, that is the conversation between healthcare providers and with patients. And that's part of that building that valuable relationship. And you talked that we in healthcare know that there is this powerful therapeutic relationship, and you talked about shifting it from the physician to the team, and that's a big part of what clinical health coaching is. In that, transforming the conversation, we really want to develop what we call behavior change specialists. Somebody that has both the skills and the science to move people's behaviors. And the second big part of clinical health coach training is really transforming the care process, which you always very appropriately talked about. And that's using team-based care. That's lifting some of the burden from the provider that they face in managing particular chronic conditions. And then lining best practice care with patient-centered resources. And by the way, sometimes we need to help patients connect with patient-centered resources, but that's a part of the role of the coach. And what's that? That's developing their skills as a care management facilitator. So what I'd like to do, then, I've kind of talked a little about the intent of the clinical health coach. Now I want to get down and talk a little bit about some of the practical aspects. And so what is this clinical health coach training that Compass PTN is making available to practices? And first I want to say it's very highly performance oriented. We believe deeply in that people shouldn't just know how to coach, they should actually be able to coach. And so I want to say that there's virtually no other program that focuses so heavily on performance. And how do we do that? First of all, there's a 27-hour self-paced, web-based learning experience that people can go to. And by the way, it's 27 hours, but a lot of it's broken up into 15, 20-minute segments, much like by the way, our brain learns that way. And so that's how we've designed this. We provide about 31.5 hours of CEUs for nurses and about 26 hours of AMA, PRA, Category 1 credit for other healthcare professionals, which is a very big load of CMEs and CEUs. So there's a great advantage in this training right there. We also have a series of 4 interactive teleclass calls so that this isn't just between the learning portal and the individual. We want the practice activities to begin to start. And then there's another distinctive feature that is tied to the performance, and that is when someone has proceeded through the training successfully, they have an opportunity to take a performance evaluation. This is having a coaching conversation with a standardized patient and earning a certificate of competency in clinical health coaching. And I think one of the 2 or 3 last things I want to say is that we provide everybody who is in this training access to an ongoing learning portal, free of charge, by the way, where there's webinars, continuing education, a variety of different things. And that's something that people who go through the training really have access to for the remainder of their professional lives. One thing to talk to those practices that are thinking about this, and that is when you begin this health coach training, probably after the first 15 or 20 minutes of training, you're going to learn things that are going to start to improve your conversation with patients. You don't have to wait until you've gone 15 hours or 27 hours. Immediately, you're going to learn things that are going to improve that relationship and power that connection that you have with patients. And so I want you to know that do this now because the benefits and the dividends start paying right away. There may be some more things that we can talk about, but there is, in the clinical health coach training, we've trained a little more than 2,500 people in 43 states right now, healthcare professionals. And we've started them on their path to becoming highly effective in partnering with patients, with picking them up wherever they are along this healthcare continuum, learning their interests, that is, evoking their interest and kind of what their star in the world is, and then seeing them as capable, which is a powerful element. Just like teachers get better performance from students when they have high expectations of them, if we can develop and work with patients in a partnership way with high expectations, we can get to the kinds of things that they need and mostly they want and they desire. And then moving these people to actual better health lives. So think about that, building a relationship, developing patients confident that they can make choices and that they can act on their own behaviors. The truth is, we like to think of this as, well, as clinical health coaches as being architects for health. And when you stop to think of it, who could think of a higher calling?
Yeah, I like that. I like that term, architects for health, Bill. I think that when you think about what we have to do with regard to this, the clinical practices are now challenged to figure out how they react to this new reimbursement model, the quality payment program. And we all know that this is going to happen to us. It's interesting. It isn't about the quality payment program. All the quality payment program does, the Medicare Part B program, is, in my mind, it is the linchpin that's going to make all of the healthcare reform stuff begin to work. And I think the important point with the quality payment program is that it's really going to happen. 2019, the payment methodology become changed, and I know that throughout my career, it's always been someday that we're going to have to do things differently. Someday we're going to have to focus on population health, and someday's officially here. I think so. First of all, thank you for your for the descriptions about what you have in the health coach program. I think embedding a health coach in any kind of a practice can be a real augment to engaging our patients and more effectively managing populations. And one thing is clear, is the way we've always done things won't work anymore. We can't take the techniques of the value-based world and do them faster or harder or more sincerely. We need to embed new techniques on how we manage our populations and our practices as we go forward. So Bill, thanks for being with us, and we look forward to working with all of our practices now as we begin to move into the world of population-based health.